Hello, good people. Welcome to the Safe Happy Life channel. Today we have roses for Dr. Rose M channel. Pretty nice roses to color our world. We're looking at episode or session 3 of depression, having looked at the introduction and having looked at the symptoms that children, tweens, and teens present when they have depression. I wish to emphasize that depression is not a passing mood, a passing bad mood, nor is it a condition that many times goes away without treatment. Remember, we said it is a common and a serious condition. So you will find that depression many times requires proper treatment. This treatment may be therapy, as in psychotherapy, or medical treatment, depending on the intensity or depending on how severe it is. And do you know that depression can recur? Sometimes depression in children can be a concurrent condition, meaning that a child has depression and another underlying condition. Let us go through a few of the reasons or causes that make children go into depression. One of these is family history of depression, because this makes them genetically vulnerable, and depression sits idle in the child or in the mind of the child until there is a trigger, just the same as the other inherited or conditions behave. They can be sitting idle, sitting ineffective until a trigger comes along. So depression is children go into depression because there is a family history of depression. However, that does not mean that all the children who go into depression have a family history of depression. No, depression in a child can be a standalone case, meaning there doesn't need to be an earlier family history of depression. The other cause of depression in children is physical ill health, especially with those chronic conditions such as diabetes and others. And also the other reason or the other cause of depression is when a child has passed through traumatic life events. This could be going after parents have gone through a divorce. This could be an abusive relationship, an abusive family setup. This could be neglect or even loss of a parent or a loved one in the family. Another cause of depression is biochemical disturbance or neurobiological disorders in the brain that cause imbalances in the stress hormone, also called cortisol. And these chemicals impact on the brain, on the working system of the brain, and the brain is not able to function properly. And therefore, a child or a person can sink into depression because of those hormonal imbalances in the brain. Another cause of depression is an underlying condition, such as a psychiatric disorder that triggers depression. Another cause is learning disorders. When a child is not able to learn as their peers are able to, this means that they have inability to keep up with the schoolwork demand. They feel helpless and this can cause depression. Another cause of depression in children is breakup of a relationship or relocating of a girlfriend or a boyfriend. We have had cases of children as young as 13, 14, 15 committing suicide because their boyfriend or their boyfriend has left them. So this is another cause of depression in children that caregivers need to be aware of. Drugs and other substance use cause depression in a child because of the chemical reactions, the company they keep, and the reasons even why they go into drugs. It is a sacred kind of catch-22 situation. Drugs causing depression and depression people going into drugs because they are depressed. Another cause of depression in children is peer conflict. When they fight amongst themselves, they feel they don't have a friend. When they bully each other in school, or even more recently, cyberbullying can also cause depression in children. And this is particularly very quiet and very hidden because a parent might not know easily that a child is being bullied. So the children shut up and the parent may not know. And if the bullying is taking place in school, you find the parent continuing to put pressure on the child to go to school. And this is where the bullying is taking place. And this means that the child does not want to go to school. When they don't go to school, their performance is not up to standard. And they feel they have fallen short of the expectations of the school, of the teacher, of the society, of themselves. And now they can only sink into a world of their own, which is depression. This and others could cause depression in children, and it's upon us as caregivers of these children to if we notice the symptoms that we mentioned yesterday in a child, we try to find out which of these causes of depression we have mentioned today could be linked to the symptoms that we mentioned yesterday. Tomorrow we shall tackle another session on the same topic, depression, so that we grow our knowledge, we edify ourselves as we try to ensure that our children live a safe, happy life, same as us. Thank you very much for watching. Thank you for subscribing. Please share knowledge. Please spread this link, and may God bless you. Bye bye.